very happy to have with me music therapist Jennifer Sokira. Jennifer has been a music therapist for almost 20 years, and we've worked together on a number of occasions here in Newtown, and I'm very grateful to have you with me. Hi, Jennifer.
Thank you for having me, Susie. I really appreciate it, and I'm really excited to be here.
So what differentiates trauma-informed music therapy from regular music therapy that most people already are have somewhat of an idea of what that is?
Which is such a great thing that so many people do understand that music therapy is a specific credentialed profession that takes place all across the country with so many people. The difference with trauma-informed music therapy, it's actually what's beginning to happen across all populations as well, is the recognition that we need to understand how trauma affects our clients' bodies so we can use that, and as well as their brains, so we can use that information and look at their responses and take that into consideration as we plan for the types of interventions that we're going to use in music therapy. So it's almost like taking a lens and looking at everything through that, because we know that trauma is pretty common. I mean, across the board and across the age ranges with the people that we work with. Even though somebody might not be coming to us to specifically work on trauma, maybe they're working on a developmental need or something else, educational need or a memory care need, it's pretty likely something has happened that affects how their body and their brain process information.
Right.
And how they respond to things. So it's almost like I said, like having a lens that you're looking through, and that's what I advocate for.
I remember when we spoke another previous time, you had said you felt that all music therapists should be somewhat trauma-informed.
Yes. For sure. And just like all of the other worlds are sort of moving into this direction, in understanding, all of psychology is understanding trauma better. And so incorporating that information, music therapy is doing the same thing. So I like that I'm able to be a part of that. So even for music therapists who work, say, with really young children in preschool settings, this can help them understand maybe what they're seeing behaviorally or emotionally from the children. And it can also provide information about how to support them and create environments that are going to be hopefully safe enough so they can do the work that they need to do in terms of their learning.
What specifically might it look like with a child who has experienced trauma or adverse childhood experiences? What might a session specifically look like, and how help them?
There is definitely not one like specific like example I could give, but music therapists use a lot of different experiences, and the hope would be that they would be attuned to what the child's needs are neurobiologically. So we would use experiences in music, for example, that would provide physical grounding. So like a nice steady beat, for example, has been shown in the literature to create entrainment and grounding and allowing a child to feel calm. So we create routine and ritual. So it's a predictable experience. We show affect regulation in the ways that we interact with the child, either one-on-one or in a group. So we demonstrate good emotional regulation, and we teach what emotional regulation can look like, and we teach children to listen for different emotions and use music to even help understand and break apart what those emotions are. So those are just a few examples. It's really individualized. Our training is such that we're taught to assess what an individual person's needs are and then create a treatment plan in music therapy, using music therapy interventions to be able to meet those goals for the child or the adult. That's the other thing. We use music therapy all the time to help adults.
That question is actually coming, but before that, I wanted to ask, has given the circumstances that we're in with COVID-19, a lot of parents, all parents are home with their children. For parents and caregivers who are caring for kids who are struggling, are there any specific tools in the music therapy realm that you could recommend that they can do at home with their child?
I think that's a great question. And there is a plethora of opportunity out there on the internet. I think though, weeding through all of it could be potentially stressful. And the last thing we need right now is to add any stress to people.
Definitely.
So I would say that if you have a local music therapist that's offering something online, definitely participate in that, because it's something you could maybe then attach to after we're back kind of in social proximity with each other again. So that would be one suggestion, is just look up who are the music therapists in your area. A lot of people are providing online opportunities, pre-recorded. So it's not the same as doing therapy. It's just a pre-recorded opportunity to try something developmentally appropriate.
Oh.
There are also music therapists offering music therapy through telehealth for a variety of populations. Right now, I'm working primarily with adults, on different psychotherapeutic issues stemming from trauma, or music psychotherapeutic issues, I should say. But there's the whole range. Music therapists, there's about 7 to 8,000 of us in the country. And so we're around, and there's lots of different specializations. So depending on where you are, the American Music Therapy Association's website is a good way to find somebody in your area. And they can also provide referrals to you.
Thank you. And how about if a parent is unable to find that and wants to try to utilize, something on their own?
I think that is ideal. And I think we all sort of know music affects us, right? We have the certain songs that make us cry, or the certain songs that remind us of happy times. Right. I would suggest for right now, keeping it as simple as you can, because that's a type of self-care, right?
Yes.
Keeping it as simple as you can for your child, and picking music that is going to elicit kind of the type of emotional environment that you're looking for. So you're noticing everybody's kind of feeling down, you might consider the music, or the types of music, or the singers or the songwriters that might elevate your mood, and alternately, thinking about music that might be grounding or calming when the environment is a little too much. It's a great tool to co-regulate with your children, but also to regulate and take care of yourself. So thinking about your preferred music and how it works for you and your family is, I think, a really solid place to start there.
Any instruments you would recommend that people may have, like drumming or?
I think it just depends on your family and what you have. I mean, it's a great time to be creative, and you could even make some instruments. But for people, a lot of people have pianos collecting dust in their house. Right. This is a great time to just plunk around, or maybe start to learn. But I'm not a big fan right in this time of suggesting anything too aspirational. So this isn't the moment to start learning that sonata or all your scales or anything like that. Whatever feels good and whatever feels either calming or uplifting to you is great. No pressure.
I recall when on a previous conversation that you had mentioned that the benefits of music therapy, but also that therapists had to be careful because there were times it can be not helpful.
Yeah. So that's, I think, one of the real benefits of working with a board certified music therapist, and hopefully somebody who uses kind of a trauma informed lens towards their work, is that we understand the difference between, or we understand what some of the contraindications can be for music. I'm careful that people understand that music, while it seems like, oh, it can be fun and safe and great, and it's not going to do any harm, it actually can do harm for people who, for example, bodies aren't able to regulate. Too fast of a tempo can create additional stress on the body. So because it can affect your breathing and your respiration rates and your heart rate, etc. So it can create a physiological response that's not optimal for moving a client into kind of their just right space where they're able to rest and digest, if you will.
Yeah, it's a great point.
Yeah. So, and the other side of that from the emotional standpoint is that we need to remember that we don't always know what people's connections to certain music are.
Yes.
So traumatic memories can be attached to music.
Yes.
And in particular, when that's the case and there needs to be processing around the trauma, a music therapist would be able to provide a music therapist with the correct specialization would be able to provide the right kind of support for that type of client. But not, it's just like in you wouldn't go to a heart doctor for a stomach problem.
Exactly.
So it's the same kind of thing. So like anybody else, you want to talk and make sure everybody's the right fit for you.
Do you get kids referred to you for issues such as ADHD that actually have an underlying trauma?
Yeah, that happens. Yeah, I have seen that in the past. And it's pretty common just from the research I've done and from my clinical practice and being in touch with other professionals as well. It is something that can happen because sometimes the hyperarousal types of symptoms look very similar to ADHD, but it's a trauma, hyperarousal symptom. When I teach that, that's one of the first things, and then it continues a kind of a difficult spiral because sometimes there's medications that aren't attuned to the actual problem that can make things harder. So it's important to just make sure the no history of trauma gets checked off before the full diagnosis of ADHD takes place.
Circling back to adults, adults and caregivers are very vocal about how hard this time is for them.
It is. I really empathize.
Yes. And so your thoughts, your insight. I know you had mentioned music therapy can be helpful for insomnia. How can an adult, what would you recommend to an adult or caregiver who's really struggling in terms of what they can do in your expertise?
Yeah. So I've been given the advice to keep it simple from my therapist, and I really appreciated that. So I will pay that forward. I empathize with how hard this is because it's really just not possible. We don't have as many hours in the day. So I think, for me, the way I've been using music is to listen and sometimes create playlists or try to use it to kind of validate my own emotions as they come up. So like, oh wow, this makes me think of this song, and so I'm kind of capturing them in little playlists, which is sort of what I always have done in my own self-care. And a big piece too, like in my family we play a lot of music, like we spin records and things like that, so kind of encouraging some of our regular, it creates a sense of familiarity and predictability for us to have music going at different points. That is our family preferences. So
and you made a great point too of just noticing what it does in your body.
So there's so much good like music in the like neoclassical meditation types of music. It's really spacious and open, and some people find it to be really calming. Because we're all kind of in a trauma response right now, that might not meet us where we need to be met. So, or at least not initially. So it's important to think about like finding music that fits where you actually are. Because if I'm trying to meditate, I'm trying to calm down, and this music is, not meeting that, and your head is racing, like you might want to find something a little more active first before you try to.
That's a great point.
That goes for trying to fall asleep. That goes for, whenever you need that kind of thing.
Thank you. That's a great point. You mentioned the resource earlier. Any other resources people can Google or reach out to?
For sure. I mean, I've been offering trainings for music therapists around trauma, and that can be found at traumainformedmt.com. And I would also say, looking at different offerings, you can search it up on Facebook. There's a lot of really nice, groups and musical offerings, not just in the music therapy realm, but also right now, professional musicians have been so generous with their performances online. So you can really see some cool stuff and get to know your favorite performers a little bit better right now.
Yes.
So I would recommend that. And AMTA, the American Music Therapy Association, so musictherapy.org, or our certification board, CBMT, org are also really good sources of information in general for finding humans who are music therapists, as well as different resources, related to our fields.
Great. Thank you so much, Jennifer. I'm very grateful. I really appreciate it, and good to see you.
It's good to see you too, and hopefully we'll see each other in real life someday soon.
All right, this is Susie, trauma-informed parent. Thank you.